Hello, my lovelies. It says that the video is started, so I hope that's the case. Today, I am going to be answering some questions that you have left on a post for my birthday. So, welcome to Cassandra's Mind Body Monday birthday edition. I'm 54, in case any of you were wondering, and let's get to your questions. So, the first question I got was from 𝐂𝐿𝐴𝐿𝐿. She had a general question about healing and wished me a happy birthday. Thank you. And I am going to kind of broach that in terms of healing from chronic pain. So I would say healing from disease in general, I would recommend taking a mind, emotion, body, and spirit approach. In other words, seek out anything that feels right to your system to try. I have always said that if dancing with a chicken under the pale moonlight makes you feel better, then dance with that chicken. So pursue what feels right to you. All right, next question from Danielle about chronic leg pain. Can CBD lotion help? So in terms of chronic leg pain, in terms of cramping, what I would look at is the balance between potassium and sodium. So one of the first things I recommend for people with chronic cramping in their legs is to up the potassium. And the two easiest ways that you can do that is through increasing your bananas or coconut water. And if neither of those things seem to make a difference, then I would probably actually go for some testing and see what the balance is between your potassium and sodium, because that's usually, unless there's an injury or scar tissue that we're talking about, one of the most common issues. The other thing I would do, if you haven't already thought of it, is obviously massage your calves and legs before bed. And you might also notice that you would get more cramps on days where you either overdo or are inactive. So our bodies really like movement, and they like it every day. And that's not to say that you should exceed what makes your body happy, but one of the common causes of different sorts of illness and diseases of the mind body is inactivity. So, movement is life. If you want to live, you got to move. So I would make sure that you have moved for the day, that you have hydrated, that you have upped your potassium, and that either you or someone you love has given you a calf or foot massage before bed, and see if that helps. And if it doesn't, PM me, and maybe we can talk about whatever's bothering you specifically. Okay, the next question from Jason and Mandy, although I think this is probably Mandy Pruitt. What remedies do you use for chronic pain? Okay, this is one of the biggest questions I wanted to answer today on my birthday. So this birthday will find me 3, almost 4 years free of chronic pain. So I was diagnosed with an autoimmune condition that was a chronic pain autoimmune condition. In other words, it wasn't going to kill me, but it was going to cripple me, and I definitely was in chronic pain. And it was so bad that for a period of time I was on morphine every day. There was a period of time when I was bedridden. So I'm very familiar with chronic pain, and having studied it for the course of my career, and then having tried it out personally and found that I was able to heal it, it is something that is a passion of mine, helping people get out of chronic pain. So I'm going to just list some things for you that I have seen over the course of my career are very helpful. And I myself have done all of these. And in fact, the last time I spoke with my doctor, to get an eye exam, she wasn't in, so I had another physician, and she asked me if there wasn't any autoimmune in my family. And I said, well, I had an autoimmune condition. And she said, well, that's strange. I don't see that in your chart. And I said, well, yeah, it was back in 2019, they found that I no longer had it. And she said, oh, I do see that in your history though. So how does that work? And I said, well, I healed it. So here are my tried and true suggestions for chronic pain. The first, and this is usually the one that is least liked, is change your diet. One of the biggest connections to chronic pain is chronic inflammation. And chronic inflammation is caused by our really crappy diet. So if you haven't already, the first thing I'm going to suggest you do is get on an anti-inflammatory diet. Now you can Google that and look at the choices that are there. I would highly recommend the SCD diet, Sam Cat Dog, or the Against the Grain diet, or some of the work from Medical Medium. You can look him up, or you can try something like the GAPS diet or Whole 30. But the gist of it is you're going to want to stop eating grain, and you're going to want to start focusing on live or living foods. So as much fruits and vegetables as you can get in, and you're going to want to eliminate sugar. Sugar is a big one because it creates extreme inflammation in the body. There is just nothing that sugar does that the body likes. So I went on the SCD diet, and that was a diet that consisted of no grain, no starch, no soy, no sugar, and no lactose. And so people say to me, well, what did you eat? And I say I ate certain meats and nuts and beans or legumes and fruits and vegetables primarily. And so a lot of food, just not things that were packaged or had a high glucose or were sugared. So you can eat honey on the SCD diet and against all grain as well. You can even eat maple syrup. So there are some sweet things that you can eat, and you can learn how to make things that are delicious, but you're definitely going to stay off sugar as we know it. In traditional Chinese medicine, we call it the four white devils, which is white flour, white sugar, white salt, and white milk. So cow's milk. Lactose, also highly inflammatory. So if you, for instance, are listening to this and thinking, okay, I guess I'm going to have to change my diet, but I'm scared to give up things that I love, then you know what? Try one thing. Give up one thing for 21 days and see if your body changes. Give up milk, give up sugar, give up grain, just one thing. And give it 21 days where you are really strict and see how you feel. Keep a record of how you felt before and after. But I can promise you that I did this diet for over a year, and it absolutely contributed to saving my life. So that's the first thing, is eliminate those foods that create inflammation in the body. We're going to want to increase hydration. So make sure that you are drinking a healthy amount of water every single day. There's a number of formulas that you can Google, but you're really going to want to drink a lot of water. And if you drink things with caffeine in them, you're going to want to double the amount of water for the amount of caffeine, because caffeine pulls water out of your system. So what that means is if you're drinking 8 ounces of coffee, you need to drink 16 ounces of water. You're going to need to replace that's what was taken and then put water in. So think of the things that you are drinking and think of their sodium content or their caffeine content, and add twice the amount of water of the ounces of whatever it is you're drinking. Movement. I mentioned that with Danielle. You need to move every single day. One of the big reasons is when you have inflammation, you need to move it out of your body. So you move to the ability that you can. If you can't hit the gym, then don't. Walk around the block. If you can't walk around the block, then don't. Walk down your hall. If you can't walk down the hall, then sit in a chair and practice stretching above your head and stretching down to your toes. And you will find that if you are eliminating inflammatory foods, if you are hydrating, that movement will get easier. Sleep. Sleep is big. If we don't sleep, we are in pain. When you sleep, you replenish norepinephrine, which is a natural pain reliever for the body. And so if you are not sleeping and not replenishing that, or serotonin, then your pain is going to increase. So when my pain was at its worst and I wasn't sleeping, that just kind of was a cycle where it had just hurt more and more. So think of sleep as a superpower and be unashamed to get as much as you possibly can while you dedicate yourself to taking yourself out of pain. Because again, I've been there and I know what it's like. Um, Now, here's some other things that are kind of outside of the norm: vitamins, minerals, nutrients. One of the leading causes of chronic pain is due, as I mentioned, to unhealthy diet, which causes leaky gut. So, probiotics. If you're not taking probiotics, start. Eliminate the foods that are making your body sick, then start taking probiotics to heal it. Um, Up your vitamins and minerals. If you're still taking your Flintstones chewable, it's time to upgrade to the adult vitamins and minerals. Homeopathy also is huge. Homeopathy has helped save my life. And little vials like this that you can get, for instance, Arnica montana, you might have heard of, really fabulous for aches and pains. There's another one called Rhus tox that's excellent for conditions like arthritis. And laxasis mutus is perfect for things like hot flashes. So that leads to the next thing. If you're a woman, primarily, and you are of age, I'd say 40 and above, then I would highly recommend getting your hormones tested, because having a hormone imbalance can absolutely contribute to chronic pain. As we age, our hormones cause a lot of problems in our bodies that most women are never even told about. And a lot of women our age, also our mothers, had hysterectomies because that's kind of what they did back then. If you were a woman of our age and you complained that you had hormone issues, they just took out your uterus. So for a lot of women my age, their mothers never talked about hormone issues with them. So I would highly recommend that you see a bioidentical hormone replacement therapist, a naturopath, or a nurse practitioner that can assist with, again, bioidentical hormone replacement therapy. These are therapies that are directly for you based on either blood or urine or saliva testing. And they are ones that work with your system. So they're not things that are over the counter or prescribed by Western medical doctors, which are often can lead to a higher risk of heart disease in women. And for men, same thing. If you're of age, get your hormones tested. It's very likely if you were active in your youth, then your testosterone has dropped significantly, in which case that can be causing problems too. Um, what else? So, aromatherapy. There are some really incredible aromatherapies out there. Some very simple ones to some fancier and really cool ones like doTERRA. Look into it and try it. There's physiological responses that the body makes both on inhalation and on application. So for some people, they are super effective. Um, Colon cleanses. If you are a huge meat eater and you've been backed up or struggled with constipation, clearing your bowels out can really help. One of the things the medical medium recommends is celery juice every morning, which I personally do. Not only does it help clean the bowels out, but it also helps clear a fatty liver. And having a fatty liver is highly linked to many chronic pain and autoimmune conditions. Um, oh, turmeric. Thinking about vitamins. If you aren't taking turmeric yet with curcumin, highly recommend it. If you're in pain, it's very helpful for hyperinflammation. You want to watch out for NSAIDs and taking them on a regular basis because they have problems with the kidneys and the liver. So over the counter or prescription pain relievers really do nothing good for the body. It's just like, if you had a flashing warning light in your car and you pulled the fuse. Well, the light's not flashing anymore, but the car's not getting better. Um, what else? Okay, maybe, ice and heat. So, heat first, 15 to 20 minutes causes vasodilation, increases the diameter of the blood vessels, means it relaxes constriction or tightness in the body. Then you would want to ice 15 or 20 minutes afterwards, and that would help cause vasoconstriction, and it would decrease the diameter of the blood vessels and help kind of set that released state. So these are all things that I've used and that I continue to use. So I hope that answers the question. If it doesn't, look me up and click my link for Calendly and take a free session with me. And I will talk with you about your specific issue, and we'll see if we can come up with some answers. Okay, I know it's 5:30 now, so I'm going to keep chatting about some of the questions that was made, but if you need to go, you go. So, okay, Lisa asked about anything that can help with tinnitus. You know, it's a really rough question. Tinnitus is a combination of a fire and a water imbalance. So if you took my free masterclass, I talked about both what the conditions are for fire and water. I think I'm also on next Monday going to spend just 15 minutes giving a overview of the elements, each individual one. So like Monday I'll do wood, just for those that couldn't take the masterclass, to give a little bit more information. But basically what I would do, Lisa, is I would eliminate all fire causing activities. So what increases internal fire? Smoking, alcohol, sugar, red meat, basically anything that in lack of movement, anything that contributes to like high blood pressure would contribute to high fire. So I would watch those activities. And also tinnitus can also be linked mentally or emotionally to extreme overwhelm and desire to no longer hear, right? So I just don't want to hear this anymore. So I would look at what's going on in your life that feels overwhelming and that you feel like you need to shut out because there's just so much. You can't handle the ringing in your ears anymore. So I hope that helps. If not, contact me. Free session. We'll talk about it. Okay. Sciatic nerve pain, Jen asked. That's a good one. And I have a really effective protocol for sciatic nerve pain. So I'm going to tell you now. Get a pen and paper. Okay. The first thing you're going to do is you're going to heat the areas. Generally, they're going to be either in the quadratus lumborum, which is the low lumbar area of your back. So if you put your hands on your hips like this with your thumbs in your back, then that is the quadratus lumborum. Also, if you go lower into your glutes and put your thumbs there, if that's tender, that is beneath the gluteals is a muscle called the piriformis, which can be confused with other muscles for the reason for bad sciatic pain. So what I would recommend is you get a heating pad and you heat that area of the body, either the low back or the glutes, for 15 to 20 minutes, as I talked about before. Then I would like you to lay on a flat surface, so either a floor, maybe on a towel or a yoga mat, or if you can't handle what is about to happen, then on your bed, but work down to the floor. You're going to take a tennis ball or two, and you're going to place these tennis balls in the small of your back where it's tender or tight, or in the glutes where it's tender or tight. Now you can do it either one on each side, or you can do one above another on one side or the other of the body. And you're going to lay on those balls for 15 to 20 minutes. Then you're going to remove the balls and you're going to get up and you're going to stretch. Google different types of stretches. There's so many out there. If you know yoga, do some yoga stretches. Pigeon is fabulous. If you're into martial arts, try serving tea. That's a great stretch. So do some stretches for 15 to 20 minutes. You're seeing a theme here. And then you're going to ice. And that ice, again, as I mentioned before, is going to set the muscles in this relaxed condition. So you're going to heat because you're going to relax the muscles. You're going to put balls there and you're going to use your own body weight, laying on your back on the balls, to gently press in and cause compression to open those spaces up. Then you're going to take advantage of that opening. You're going to stretch those areas and you're going to ice it. and it will make a huge difference. I recommend doing this first thing in the morning and last thing at night before you go to bed. And you will be surprised very quickly how much pain relief you can get. So again, heat, ball, stretch, ice, 15 to 20 minutes. And if you have questions, contact me. Okay. Michael says he is fire and his greatest pain is in the traps and cervical vertebrae, and his wife is all things water. So things get steamy. Good for you. So I would recommend for neck and shoulder discomfort, go back and watch my videos, either on this under #video or on YouTube under my name, and look about shouldering burdens, right? Because the mental and emotional components for shoulder pain really are significant when it comes to dealing with shoulder constriction. So highly, highly recommend. Go back and watch the videos and see if you can help reframe some of your thoughts. The next thing I would recommend is there's a couple of really good massagers online that you can pick up on Amazon. One is a acupoint device that is shaped kind of like a hook that you can hold in the front, and it uses to push and pressure on the neck and shoulders or in the spine or low back and upper back near the spine, and you can release some chronic tension that way. The other thing I recommend is dragging forward through your shoulders several times a day, as well as making sure throughout the day that you are stretching and you are looking and you're stretching your neck. We get so hyper focused that we don't do any neck stretches or any shoulder massages, and we really need to. So I hope that helps. Let's see. Earth and water imbalance input on vertigo. So Janice, I linked the Facebook video that I did on vertigo. But you're right, it is an earth and water imbalance. So what I would look at is watching those foods that are trigger foods for both earth and water. So stay away from salt and sugar, as well as taking time for self-compassion in the time of winter, which is all about those sacred R words, rest, recuperate, renew, restore, replenish, and really taking to heart what it means to go within and to trust yourself and to love yourself. So think of those mental and emotional components for water and earth. And looks like, how to focus your thoughts on wellness and healing when you're in the middle of pain. So it's a great question, Sue. Thank you for asking. And, it's something that I really, really struggled with because I was in chronic pain. And what I found were the most helpful things to do were meditate, number one. So I did that a lot. And I didn't do it in any sort of fancy way. I just closed my eyes and tried to release my thoughts, especially those that were linked to being in pain. I also did a lot of ritual or prayer work, working with deities and beings of light that I felt supported my journey. And I also did things that made me happy. So while I was kind of stuck in bed for about 6 months, I really focused only on those things that would bring me joy. So I listened to music that made me happy. I watched shows that made me happy. I read books that made me happy. I played games that made me happy. And I focused on all the positive things I could. And I focused on how I wanted to feel and not how I did feel. And then I think that is the number one healing component, no matter what you have. Don't focus on how you feel badly. Focus on how you want to feel. And all those ways either you did feel and you remember feeling, or all the ways you believe you will feel when you heal. Visualize that perfect body, that healthy body, that happy soul, and keep your thoughts there. Don't let them ruminate on how you don't want to feel. And the last question here, I don't really have an answer for, and that's why I've saved it for last. Al, lung and metal imbalance as a cause for chronic skin problems. A treatment plan, please. My friend, I don't have one. I know that hydration is a huge key, obviously, and breath work is a huge key. So, if I had a client, which I don't happen to have, with chronic skin conditions, I would give them a breath program and have them work with different types of breathing, perhaps some yogic breathing. I would also make sure that they were hydrating, and I mean using that rule of twice the amount of caffeine intake. Everyone I've ever known who had chronic skin conditions were chronically dehydrated and also very high in the fire elements. So, like I just mentioned before, if they're smoking, if they're eating sugar, if they're eating meat, if their body is chronically dehydrated, if their body is chronically inflamed, I would treat that first. And then lastly, the mental and emotional components for skin issues are people who are trying to push other people away generally. So it's kind of that don't touch me, I don't want to be touched, or don't look at me, I don't want to be noticed. So I would work with the mental and emotional components of that. So hopefully I answered everyone's question to the best of my ability. And if you want to get down in the nitty gritty with me, I will post the Calendly link again. Book a discovery session. It's free. And I can hopefully work a little more intensively on something just for you. And I also have a Freedom from Pain program, which is a 6-month program where I meet with you live on Zoom twice a month. And there's also some texting and some Voxer calls in between. And I have a very specific protocol that I use to work with people in chronic pain and chronic disease. Basically, I took what took me 3 or 4 years and I kind of put it into 6 months. So I'll post that below as well. All right. I hope you all had a wonderful harvest, Thanksgiving, Tribesgiving, Friendsgiving, whatever it was that you did. And thank you for joining me on my birthday. And take care of yourself for me. Okay? All right. Bye.